Hello, everyone. My name is Mary Bowen. I have been an RN for over 30 years and currently work as a nurse educator in an ICU in New Orleans, Louisiana. I have been in my current facility for about 11 years. I am here today to help healthcare professionals new to the field learn about U.S. healthcare and its major components and how each impacts justice and equity of the system. This is a tall order for a short time together, so let's get started. First, I would like to give a broad overview of the system. U.S. healthcare is complex and multifaceted. It comprises various institutions, organizations, and stakeholders that provide medical services to the population. It's important to note that referring to U.S. healthcare as a system is a bit of a stretch due to its decentralized nature and the involvement of private and public entities. The term healthcare market is a more accurate description. What are the key components that make up U.S. healthcare? In his book, The United States Healthcare System Overview, Stephen Wagner includes three major components: providers, settings, and purchasers. We will discuss each of these in further detail as we go. However, first I would like to discuss why it is important for you to understand this complicated issue. Understanding the healthcare delivery system that you are entering as a new professional is crucial for several reasons. The people we care for, patients, are the center of everything we do. As a healthcare professional, you are at the forefront of patient care. You must understand how the system functions to navigate it effectively and deliver high-quality care. Understanding the different components and how they interact will help you coordinate care, collaborate, communicate, refer patients to appropriate specialists, and help them make informed decisions about treatment options. The healthcare industry is heavily regulated. Policies and regulations are constantly evolving to shape care delivery. Professionals need to be familiar with these regulations to ensure compliance, provide care that adheres to legal and ethical standards, and advocate for their patients. The healthcare system has limited resources. Professionals entering the field must understand how to optimize resource utilization. This includes referrals to other providers, where to send your patients for appropriate care, knowledge of insurance reimbursement systems, budgeting, and healthcare economics. Continuous improvement in healthcare delivery is crucial for enhancing patient outcomes. The healthcare field constantly evolves with advancements in technology, research, and treatment options. By understanding the healthcare delivery system, you can identify areas for improvement as well as implement and adapt to changes. You must also understand quality improvement methodologies, patient safety protocols and evidence-based practices, and monitor outcomes to enhance the quality and safety of care. These are some of the issues you will face as you embark on your career in healthcare. Understanding the system is essential. It will enable you to navigate the complex landscape, deliver quality care, collaborate effectively, adhere to regulations, optimize resources, promote patient safety, and stay abreast of advancements. Sounds like a lot, and it is a lot. It is vital that you understand that you must empower yourself to make informed decisions, contribute to healthcare improvement, and ultimately enhance patient outcomes. Isn't that what you came for? But before we dig in, I would like to address one more thing. As we move through each topic, we will examine how each component impacts justice and equity in healthcare. I want to make sure that you understand the principle of equity. Equity is an essential concept in healthcare. It refers to ensuring that all individuals have equal access to high-quality healthcare services and resources, regardless of their background, race, ethnicity, socioeconomic status, gender, location, or any other characteristics. Healthcare equity aims to eliminate disparities in health outcomes and provides everyone with fair and just healthcare opportunities. Imagine a scenario where two people with the same medical condition need the same treatment. Healthcare equity means that both individuals would have the same opportunity to access medical care, regardless of their situation. It ensures that both patients receive the same level of care and have an equal chance of achieving positive health outcomes. Equity is not the same as equality. Equality means treating everyone in the same way. In the first group, you see each of the people have the same block to help them reach the apple. But this does not address the specific needs and barriers that each individual faces. The short guy is not going to get his apple without a different approach than the tall guy. Equity acknowledges that people have different circumstances and requires additional support and resources for disadvantaged or marginalized people. Once the short guy gets the proper block to stand on, he can get his apple. Healthcare equity is essential because it helps improve overall public health and reduces health disparities among different populations. When healthcare is equitable, individuals are more likely to seek preventative care and early interventions, leading to better health outcomes, healthier communities, and reduced healthcare costs in the long run. To achieve healthcare equity, healthcare organizations, policymakers, and healthcare professionals must be aware of the existing disparities and work together to address them. Equity strives for a healthcare system that treats everyone fairly, ensures equal opportunities for good health, and focuses on reducing disparities to create a healthier and more equitable society. Now, let's get down to the bones. First, let's talk about the who of our healthcare system, the providers. Providers are the backbone of the healthcare system. A provider is anyone who directly cares for a patient. The list of providers is vast. According to Shi and Singh in the text Delivering Healthcare in America, a Systems Approach, healthcare is the largest workforce in the nation, making up 12% of the total workforce in the U.S. But despite being one of the largest professions, there is an ongoing struggle with shortages of nurses and physicians and other allied health professionals. The need for these professionals is consistently increasing as the population of the country ages. The turnover in the field is high due to the high demands and stress of the job. Burnout is a real problem that has only worsened since the COVID-19 pandemic. A lot is riding on the shoulders of today's healthcare providers. She and Singh have providers broken into three categories: physicians, nurses, and allied health providers. Let's take a look at each of these. Physicians are extensively trained medical professionals who diagnose and treat illnesses, injuries, and various health conditions. In the practice setting, you may hear physicians or doctors referred to as providers, but in our case, we are using the term providers as all those who deliver care to patients. Physicians play a crucial and central role in healthcare systems worldwide. The role of a physician is multifaceted and encompasses several vital responsibilities: diagnosis, treatment, management, preventative care, coordination of care, and education. Physicians are usually defined as generalists or specialists. Generalists, also known as primary care physicians, are medical practitioners who provide primary health to patients of all ages and genders. They serve as the first point of contact for individuals seeking medical care. They manage various health conditions, including common illnesses, chronic diseases, and preventative care. Generalists play a crucial role in promoting overall health and coordinating patient care. Common types of generalists include family practitioners, caring for all patients of all ages, internal medicine, focusing primarily on adult health care, and pediatricians caring for infants, children, and adolescents. Specialists are physicians who have undergone additional training in specific medical areas after completing their general medical education. They concentrate their expertise on a particular field of medicine, allowing them to provide in-depth knowledge and advanced care for complex medical conditions. Patients are usually referred to specialists by generalists when specialized knowledge or treatment is required. Specialists bring advanced knowledge and techniques to address complex health issues. They collaborate with generalists and other healthcare professionals to ensure comprehensive and coordinated patient care. The second category of providers is nurses. Nurses make up the largest group of professionals in healthcare. There are 3 levels of nursing practice: licensed practical nurses, or LPNs, registered nurses, or RNs, and nurse practitioners. LPNs, or licensed practical nurses, are entry-level nurses who complete a practical nursing program. They provide basic patient care like taking vital signs, administering medications, and assisting with daily tasks. Registered nurses have more advanced training than LPNs. They complete a nursing degree and are licensed to provide a broader range of care. They can do everything LPNs do, but also develop care plans, perform more complex procedures, and often supervise LPNs. Nurse practitioners, or NPs, sometimes referred to as advanced practice RNs, have an advanced nursing degree, usually a master's or doctorate, and can work more independently. Nurse practitioners can diagnose illnesses, prescribe medications, and even manage patients with chronic conditions, similar to physicians. Nurse practitioners have specialized skills and training, allowing them to take on more responsibilities and significantly impact patient care. They often work closely with physicians and can be the primary health provider for some patients. The third and final category is allied health providers. Allied health care providers are diverse professionals who work alongside doctors and nurses to support patient care. There's a wide range of roles that are grouped under allied health. Some examples include medical assistants, respiratory therapists, radiology techs, physical therapists, occupational therapists, pharmacists, laboratory techs, dietitians, and social workers. Really, anyone who has received training and been certified in an area of science related to healthcare is an allied health professional. There is one more group that plays a part that you will need to be aware of: administrators. Administrators do not provide direct patient care. However, they do have a role in the dynamics of healthcare. They oversee operations, finances, and ensure regulatory criteria are met while providing leadership and strategic direction for the organization. The role of all providers is pivotal to healthcare. However, the distribution of healthcare providers is inconsistent, leading to inequities in access. Rural areas and certain ethnic groups may have limited access to healthcare professionals, exacerbating disparities in health outcomes. Low-income communities may face financial constraints that hinder their access to healthcare services. Language and cultural differences can create obstacles in accessing healthcare services for certain ethnic groups. However, many providers are actively working to address these inequities. They engage in community health programs, promote cultural sensitivity, and provide language services, and embrace telemedicine to reach underserved populations. Now that we have covered the who of healthcare, let's cover the where. There are many different settings where healthcare is delivered. In healthcare, there are different settings where medical services are provided to patients. The main categories of healthcare settings are inpatient and outpatient. The choice of setting depends on the severity of medical condition, the type of treatment needed, and the level of medical supervision required. Patient settings refer to healthcare facilities where patients receive medical care and treatment while being admitted and staying overnight. These settings are designed for patients who require more intensive and continuous medical supervision, procedures, or treatments. Hospitals are the most common inpatient setting. They provide a wide range of services, including emergency care, surgeries, specialized treatments, and long-term care for patients with chronic illnesses. Hospitals have various departments such as emergency department, intensive care unit, and surgical suites. When referring to a hospital, we often think of an acute care hospital, but there are other types. Generally speaking, a patient is first admitted to an acute care hospital for a short-term stabilization and then sent to other specialty hospitals for extended care. A rehab hospital specializes in therapy, physical therapy, occupational therapy, and speech therapy. Often stroke patients are treated here to build strength and return to perform activities of daily living. LTAC, or long-term acute care hospital, is used when a patient has needs beyond a skilled nursing facility for an extended period. They provide services such as long-term IV antibiotics or mechanical ventilation. Psychiatric hospitals specialize in providing mental health and behavioral health services to patients with severe psychiatric conditions. They offer a safe environment for patients requiring behavior stabilization and intensive therapy. The person must be medically stable to be admitted to this type of inpatient treatment. Skilled nursing facilities, or SNFs, are inpatient settings that offer short-term rehab and long-term care for patients with extended illness or injuries. They provide 24-hour nursing care, therapy services, and assistance with daily activities. A SNF is sometimes used in place of a rehab or LTAC facility, depending on their services. One other type of inpatient facility is an inpatient hospice facility. Hospice is the end-of-life care for the dying patient. Hospice can also be provided at home or in a skilled nursing facility, depending on the situation and the patient and family wishes. Outpatient settings, on the other hand, provide medical care and treatments to patients who do not require overnight stays. These settings suit patients with less severe medical conditions, those receiving follow-up care, or those undergoing minor procedures. Outpatient clinics offer various medical services, such as primary care, specialty consultations, vaccinations, and diagnostic testing. Patients visit these clinics for scheduled appointments and return home the same day. Ambulatory surgery centers are facilities for outpatient surgeries and procedures. Patients undergo surgery for treatments and can go home on the same day after a short recovery period. Urgent care centers provide for conditions requiring prompt attention but not life-threatening. They offer availability during non-traditional business hours to accommodate patients with a non-emergency medical need. Some medical services can be provided directly in the patient home. Home health care allows patients with chronic illnesses or those recovering from injuries or surgeries to receive medical attention while remaining in the comfort of their own home. Just like the providers of healthcare, the healthcare settings are not equally accessible. Their distribution varies. The urban areas have a higher concentration of facilities and services, creating disparities in access to care. Additionally, urban areas may have better equipped facilities, leaving rural communities with limited resources and services. Low-income communities and specific ethnic neighborhoods may also lack adequate health care facilities, including primary care clinics and community health centers. This shortage can result in delayed or inadequate care for residents. Efforts being made to bridge these gaps by expanding telehealth services and implementing sliding scale fees for those who cannot afford expenses. Ongoing efforts to address social determinants of health and improve healthcare access to all communities include the collaboration of providers, community public health organizations, and government officials. So that covers the who and where. Now let's talk about how. How do we pay for healthcare? Healthcare purchasers are entities or individuals responsible for paying for healthcare services on behalf of patients or themselves. They play a critical role in the healthcare system by facilitating access to medical care and covering the costs of healthcare services. In Delivering Healthcare in America, a Systems Approach, she and Singh explain in the U.S., payers include government, insurance, and private pay. Government purchases healthcare services in the United States through various programs and agencies. One prominent example is the Department of Veterans Affairs, or the VA, a federal agency that provides healthcare services to eligible veterans. The VA is a government-run healthcare system that serves as the primary purchaser for and provider of health services for military veterans. It was established to fulfill the commitment to providing comprehensive medical care and support to those who have served in the U.S. Armed Forces. The VA operates a network of nationwide medical centers, outpatient clinics, and community-based outpatient clinics. Medicare and Medicaid are two other significant examples of government purchase of healthcare services in the U.S. Medicare is a federal health insurance program mainly for people aged 65 and older and younger individuals with specific disabilities. The government purchases health care services for eligible beneficiaries through Medicare Part A and B and private Medicare Advantage Part C plans. Conversely, Medicaid is a program that provides health coverage to low-income individuals and families. States administer Medicaid, but the federal government provides funding and establishes specific requirements. Medicaid purchases healthcare services for eligible beneficiaries from healthcare providers participating in the program. These examples demonstrate how the government plays a significant role in purchasing healthcare services for specific populations or groups of people in the United States. Each program serves as a distinct purpose and helps ensure access to healthcare for the respective eligible beneficiaries. Governments may also fund public health programs and initiatives to promote preventative care, disease control, and population health improvement. Insurance is another purchaser of healthcare. Insurance entities collect premiums from individuals or employers and pool these funds to cover medical expenses. Insurance companies negotiate with healthcare providers to establish networks and payment rates and process claims for covered services. The majority of insurance is provided through employers as a benefit to employees. But insurance is also available for individuals and families to buy on their own, called private health insurance. It allows policyholders to access a range of health services based on the terms of their insurance plan. Private pay refers to patients who directly pay for healthcare services out of pocket. Some people may not have health insurance coverage by choice or due to financial constraints. In such cases, they are responsible for paying all their healthcare expenses. Even for those with insurance coverage, there may be out-of-pocket costs for particular services or treatments not fully covered by their insurance plans. The interaction between these healthcare purchasers and healthcare providers, such as doctors, hospitals, and clinics, is critical to the healthcare delivery system. Healthcare purchasers play a crucial role in determining the availability and how individuals and communities access healthcare services. Their decisions and policies can influence the overall cost, quality, equity, and access to healthcare. Healthcare purchasers can inadvertently create inequities in healthcare access through various mechanisms, resulting in disparities in the availability and affordability of medical services for different populations. Health insurance companies may offer limited coverage options based on different insurance plans. Some plans may have narrow networks of healthcare providers, limiting access to specific hospitals or specialists and creating disparities in access to high quality or specialized care, especially for individuals in rural or underserved areas. Additionally, insurance premiums can vary based on factors like age, income, and health status. While some individuals may afford comprehensive coverage, others, particularly those with lower incomes, may struggle to pay high insurance premiums, leading to potential gaps in coverage. Eligibility criteria for insurance may exclude specific vulnerable populations. Government-sponsored healthcare programs like Medicaid often have eligibility criteria based on income and other factors. While these programs aim to provide coverage for low-income and vulnerable populations, some may not meet the strict eligibility requirements and cannot afford other insurance policies. Additionally, eligibility criteria may not fully consider the unique healthcare needs of specific vulnerable populations, such as individuals with disabilities or those from specific ethnic backgrounds. This lack of tailoring can result in suboptimal access to specialized services or culturally competent care. Healthcare purchasers may differ in the scope of services and medications they cover. Some insurance plans or government programs may only partially cover essential services, preventative care, or specific medications. Patients with conditions that require costly treatments or medications may face financial burdens limiting their access to critical, necessary healthcare interventions. Moreover, mental health services and reproductive health care can be subject to disparities in coverage. Limited mental health coverage can hinder access to mental health treatment, and restrictions on reproductive health care may affect access to family planning services and specific medical procedures. Healthcare purchasers can take proactive measures to address inequities in healthcare access and ensure that vulnerable populations have better opportunities to receive necessary medical care. There is work being done towards achieving this goal. Some state governments have expanded Medicaid coverage to include more low-income individuals and families. However, the eligibility criteria for Medicaid varies by state, and not all low-income individuals qualify. In collaboration with the government, private health insurance companies can offer insurance subsidies and assistance programs for low-income families. These programs aim to reduce the financial burden of health insurance premiums, deductibles, and co-payments, making insurance more affordable and accessible to those with limited financial means. The Affordable Care Act of 2010 addresses some of these issues directly by mandating requirements such as removing pre-existing conditions, creating markets for healthcare insurance, and eliminating higher premiums for specific health conditions or age. By providing subsidies, assistance, and expanding coverage, healthcare purchasers can help low-income families obtain adequate health insurance coverage, improving their access to various medical services and treatments. Wow, we have covered a lot of information, but there is still so much more to learn. As you embark on your healthcare career, you will learn more than the basics that we have discussed here. What I have covered is a very general introduction. You'll need to continue to seek learning and understanding, but with time and experience, you will be able to navigate the system and advocate for your patients. This responsibility seriously It will lead to a more equitable healthcare system where everyone can access necessary medical care, reducing disparities in healthcare and fostering a healthier, more equitable society. Thank you.